with your eyes. Okay, now we're just going to do all above. Good, and all below. So, from above, below, and above, and below. Okay, now we're going to test the center of your face. Typically the light is brightest when it's right between your eyes. Okay, I'm going to shine this right between your eyes. Now, is that very, very bright? Okay, and I'm going to test that right from up here. Is that also very, very bright? Okay, and from below is it very, very bright? Okay, now I'm just going to quickly ask you to just relax, close your eyes, and I'm going to ask to see if you can still see the light when I flash it on top of your eyes, okay? So close your eyes. I'm just going to quickly can you still see that? Okay, and right here. Can you still see that? Okay, and right here. Can you still see that? Okay, and right here. Can you still see that? Very good. Thank you so much. We're done with the light portion of the exam. Okay, what we're going to do now is test your visual field. We're just going to test your visual field. What we're going to do is I'm going to ask you to just stare dead into my eyes, and I'm just going to test your peripherals. We're going to do a lot of visual field stimulation, and these exams are going to help me assess if your eyes have any problems with focusing and looking, especially around your peripherals, okay? So let's begin. This part's a little bit fast, a little bit more chaotic than normal, okay? So I'm just going to flash my hands to the side of your face, and I want you to let me know when you're unable to see them, okay? Let's begin. So we're going to start on this side, right to the right. Here we go. Okay, and when is it unable to see? Okay, on right here. Okay, and then right here. Okay, let's try it with both hands now. Okay. So right below, and what if I do it above? Okay, what if I do it below? Okay, what if I do it above again? And what if I do it below? Okay, now we're gonna do it from side to side. Let's do it. You can see them now, and when can you see them? Okay, they're gone now. Let's try it again. And they're gone. What about from the side? Gone. From the side, gone. So it looks like your peripheral vision is looking pretty well. Now I'm gonna ask that you, every time I move a hand, I want you to just look if it's going to the left or to the right, okay? And this side being the left and this side being the right. So I want you to just direct your vision each side I flip the hands, okay? Let's begin. Good, 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 very good, good, and good. You're doing very good, you're doing very good, you're doing very good. I'm gonna do something. It's called distraction. Just a bit of a distraction exam. What I'm just gonna do is I'm gonna put my hands right above your eyes, and I'm gonna see if you're flinching, okay? I'm gonna get a bit close. Just gonna get a bit close, and we're gonna see if you flinch or if you close your eyes just a little bit. It's a natural thing to flinch, but I'm just gonna quickly test you just by popping my hands a little bit too close to your eyes, okay? Let's begin. Okay. 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 Just gonna get a bit close now. Excuse me. Just going to. Okay. Now could you just close your eyes for me? Thank you so much. I'm just gonna feel around your orbitals. Just going to feel around your orbitals. I'm feeling for swelling behind the eyes. Okay. Just feeling for swelling behind the eyes. Okay. Very good. Very good. Very good. Now I'm just gonna ask you just to take a look around, okay? I'm gonna point at the Snellen's chart here now, but what I'm just going to do is going to point at the line. Just going to point at a line. What I want you to do is just read the line off. As you can see, it's just from right there, okay? Perfect. So you are currently very far away from the Snellen's chart, but for the best of your ability, I want you just to assess and see if you can read the lines with both eyes open, okay? So first I'm going to point right here to one of the lines. I'm going to point with my little pointer here. I'm going to point right here to line number 3. Are you able to read this line? Okay, and can you read it back to me? What letters are these? Okay, we have D. We've got an O, and we've got a C. Very good. I'm going to point to number 1. Is that a very visible letter to you? Okay, what is that? Okay, that is E. Very good. That is E. Very good. Line number 1. Now, I'm going to go all the way to line number 8. It gets a bit So your eyes are working perfectly together. I'm gonna cover one eye. I'm gonna ask you if you can see something different, okay? First, we're gonna start off by covering your right eye. I'm gonna ask you, are you seeing any differences? Are you seeing any differences at all with your visual field? Perhaps the Snellen's chart is looking a bit more detailed as I cover your right eye. How are you seeing this? Okay, so it looks to be quite similar. Okay, I'm gonna ask you, how many fingers am I holding up now? Okay, how many fingers am I holding up now? Okay, how many fingers am I holding up now? Okay, how many fingers am I holding up now? Okay, and how many fingers am I holding up now? Okay, and how many fingers am I holding up now? Okay, very good. Now I'm just gonna cover your other eye. I'm just gonna cover this eye right to the left. Okay, I'm gonna ask you same question. Is this visual field kind of similar? Just say one eye is a bit more, it has a bit more detail than the other. Okay, now I'm just gonna test with the same question. How many fingers am I holding up? Okay, how many fingers am I holding up? Good. 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 Very good. Looks like your eyes have very similar distances and actually very similar prescriptions. I'm just gonna write that down very quickly. Okay, I'm gonna give you something that's just quickly called a color line test. So I have two pens here, and they are different colors. Now I'm first gonna ask you, are these two colors different to you, or do these look exactly the same? Are you someone who has color deficiency when you look at things? Are you someone who can see the full color spectrum? Okay, so I see that you've chosen that you have a full color spectrum, okay? And are you able to assess what color this is? Right on to the left. What color is this? Okay, I'm gonna get this a bit close to you. What color is this? Okay, understandable. So this is an orange red. I have color deficiency, so it looks to me like it's red. Now I'm just gonna put this up right next to you. And what color is this one right to your right? What color is this one? Okay, this one is yellow. Very good. So what I'm gonna do is I'm just gonna ask you if the color changes as I just place this right across your visual field. I'm just gonna ask you, does the color stay the same as I move this across your eyes? Okay, does it? Very good. Okay, we're gonna go below. Keep looking at it. Does the color change at all, or does it stay the same orange? Okay, we're gonna try right from above. Does the color stay the same, or does it change as I move it across your visual field? Okay, very good. Now we're gonna try this along with the yellow. I'm just gonna put this across your visual field. Does the color of the yellow change as I move this across your eyes? Okay, now let's try from below. Does the color change at all? No? Okay, and from above, does the color change at all? Okay, very good. Now I'm just gonna quickly just get a bit close to you. I'm just going to take a look to see what color your eyes focus on the most. Okay, very good. Now I'm just going to actually just cover a portion of the Snellen's chart. And can you tell me what the easiest line to read is? Is it 1? Okay, and I'm just going to put it all the way down. And can you tell me what the most easy line before it gets a bit difficult to read is? Okay, so about 7 or 8. Okay, understandable. Thank you so much for that. Now what I'm going to do is just press on your eyes. What I'm going to do is I'm just going to carefully press on your eyes, press on your orbitals, and I'm going to go press underneath the eyes, okay? I'm just feeling for any swelling, again, similar to what I did prior, but now that I've been testing your eyes, sometimes I can feel a bit of strain, so close your eyes. Very good. Just going to feel on top of the eyes, just going to feel on top of the eye, just going to feel on top of the eye, just going to feel on top of the eye, just going to feel on top of the eye, just going to feel on top of the eyes. Okay, then right below, just going to feel right below the eyes, just feel right below the eyes, just feel right below the eyes. Okay, very good. I'm just going to press with the thumbs, press with the thumbs. Very good. Just going to press with the thumbs, press with the thumbs. Very good. You can open your eyes now, okay? Now I'm going to ask you to do something with me. It's called the blink assessment, okay? This is what I'm going to ask you to do. Just close your eyes and open your eyes, close your eyes and open your eyes. I'm going to just change the speed at which I say close and open your eyes just to test to see if your eyes are functioning properly. some people are not. Okay, so I have the light right here. Can you see that? No light at all. Okay, what if I do it right in the center? No light at all. What about from here? Nothing. And what about from here? Okay, I'm just gonna shine this really quickly into your eye. Anything at all? No. And anything at all? Okay. Looks like your eyes are not too sensitive. A lot of people actually cannot see that. Only the few that have very, very, very sensitive eyes can see such an interesting, strange ray of light. Is that the results in? It looks like your eyes are just overworking themselves. Do you work in front of a computer often? Yeah, are you often in front of your computer or your phone? Yeah, I can tell. You're gonna have to just cool with that and maybe take some breaks from time to time. I always suggest every 2 to 3 hours, take like a 10 to 15 minute break just to let your eyes relax a little bit. And especially because I'm looking at eyes all the time and I'm looking at computers all the time, I often take breaks just to relax and set my eyes to rest. Overworking eyes can always cause problems in the future, so we want to just prevent that from happening because your eyes are beautiful as the way they are. And now you're here and your eyes are great,